1887, the first formally organized body representing orthopedic surgery, the American Orthopaedic Association, or the AOA, was established. This group met annually for fellowship and for the advancement of orthopedic surgery knowledge and science. The AOA was an organization of orthopedic leaders who recognized the importance of creating critical safety and performance standards that would protect patients. In 1931, the AOA formed two committees, one of which became the American Academy of Orthopaedic Surgeons. The other was charged to investigate the establishment of an orthopedic certification board. Knowing that there's no more qualified group to set performance and safety standards than the orthopedic surgeons, the AOA recommended the creation of a group consisting of representatives of the top professional associations of the time, including the American Orthopaedic Association, the American Academy of Orthopaedic Surgeons, and the section of orthopedic surgery of the American Medical Association. The formation of this committee established the important tradition of physician self-regulation in orthopedic surgery. In February 1934, the American Board of Orthopedic Surgery, the ABOS, was officially founded, with a board of directors representing those important organizations. The AOA, the AAOS, and the AMA continue to be the nominating bodies for the ABOS Board of Directors. Since our beginning, the ABOS has strived to do the right thing. Soon after its establishment, the ABOS formed an examinations committee, an eligibility committee, and a residency training committee. The Residency Training Committee was responsible for evaluating hospitals and medical schools that were educating young surgeons to become orthopedic surgeons. In 1936, the ABOS published the first formal educational and certification standards for orthopedic surgery in the United States. During its first 50 years, the ABOS issued lifetime certificates for board certification. These certificates had no expiration date and were awarded to orthopedic surgeons who passed initial certification examinations. However, from the earliest days, the ABOS has recognized that medical knowledge and guidelines for appropriate practice are continually evolving. Therefore, in 1986, the ABOS made the decision to issue time-limited certificates, stipulating that initial board certification was valid for 10 years and that orthopedic surgeons would have to successfully pass an examination to be recertified for each additional 10 years. In 2000, All-American Board of Medical Specialties member boards agreed to evolve their recertification programs into the Maintenance of Certification, or MOC model. While MOC as a term was new, many of its components were not. Board certification for the ABOS has never just involved passing an examination. ABOS board certification is a process that looks at all aspects of a surgeon's practice. For instance, ABOS has always believed that peer review is a critical process to assess and maintain quality, determine adherence to performance standards, and maintain credibility to those outside the profession. Additionally, the ABOS has used surgical case lists for many years as a metric to assess a diplomate's practice and provide diplomates with an opportunity to self-evaluate their performance. The board has also required continuing medical education and self-assessment examination credits to make sure surgeons are staying up to date within the field. The ABOS periodically updates the MOC program to make sure it's relevant and not overly burdensome for diplomates, while continuing to ensure that the elements of the program protect the public. For example, creating options other than a traditional multiple-choice recertification examination to assess a surgeon's knowledge. One alternative is the ABOS Web-Based Longitudinal Assessment, or ABOS WLA, which allows diplomates to answer questions derived from journal articles at a time that works for them, using their own computer in whatever location they prefer. In addition to improving the MOC program, the ABOS is also working with residency programs to improve the measurement of competency for orthopedic surgeons in training. The ABOS launched graduate medical education tools to provide a system for measuring residents' acquisition of the orthopedic knowledge, surgical skills, and professionalism necessary to become a competent orthopedic surgeon. Directors of the ABOS are elected by current board members from slates proposed by the American Academy of Orthopaedic Surgeons, the American Medical Association, and the American Orthopaedic Association. The board consists of 21 members, including 20 practicing orthopedic surgeons and 1 public member, all of whom serve without compensation. The ABOS's founding principles have always been and will always remain serving the best interest of the public, our patients, and the profession of orthopedic surgery by certifying a practicing orthopedic surgeon's knowledge, skills, and professional behavior. We provide an important service to patients and the public, allowing them to make intelligent and informed decisions regarding their orthopedic care. Looking ahead, the ABOS will continually strive to find new and innovative ways to support these guiding principles while remaining accountable to our stakeholders.